why isn't Reba Mcentire aging? Reba Mcentire is currently 67 years old, and she looks great. So the question is, why hasn't she aged in the last 20 or 30 years? If we look at her when she was younger in her 20s, we can see she has her characteristic red hair, kind of cute features. She has a cute upturned nose, a little bit of a heavy upper eyes and brow, and then of course that contagious smile. So if we look at her in her 30s, which was in the early 1990s, this was pre-Botox and fillers, which a lot of people that live now don't realize, but we see again, she's thin, she's athletic, she has this bubbly personality, and she looks great. So if you look at her in her 40s, which is now in the 2000s, she's aging gracefully. I really don't see any changes in her face per se. I think just the normal changes that we'd see people get into their 40s. She has denied ever using Botox and fillers, so probably not using them, at least at that time. And then she still has that same nose, same hair. She's kind of maintaining her mid-face fullness. Her lips, and particularly her upper lip, has always been very thin, and I don't see any change in that as well. And again, her heavy upper eyes and brow are still there, so I don't think she's done anything at this time. So now if we get into her 50s, which is kind of late 2000s, 2009 to 2012, we see some photos of Reba, and I think she has a little bit more mid-face fullness. So I'm a little suspicious there that she might have been playing around with some fillers in her mid-face. Again, I don't see too many changes in her lips, but again, if there's no changes, she might be just maintaining a little volume in the lower lip and upper lip, but that upper lip's always been extremely thin. And then also, what I think is one of the best things for people to maintain their youth is she's in good shape. She kept her body in shape, which also keeps her face in shape, and so I think she looks great for being in her 50s. So if you look at her in her 60s, she still looks great. So I think there is a maintaining or slightly more fullness again in that mid-face, and I think again that's suspicious for things like fat grafting or fillers. You also notice still has that thin upper lip, and she's maintained all of her other characteristics, her characteristic hair color and style, didn't change her nose. So I think she's maintaining her look rather than trying to change it, which again goes more unnoticed rather than somebody who's trying to go too drastic and changing their entire look, because that's when all the alarm bells go off, which is why I recommend for everybody, including celebrities, to do it more gradually so that you don't give away the secret. One thing I do find interesting is, in my research, I was trying to find some profile views of Reba, and they're really hard to find. And that's one of the things you really want to look at to evaluate the neck. So I found it interesting that it was really difficult to find a true profile view of her in her neck. So now if we come to her current age of 67, we see again Reba looking great. And as I always say, nobody just doesn't not age. So when we see people that aren't aging at all, then it is very suspicious that something was done more setting the stage or preventative or maintenance, but also done conservatively. So I am suspicious at some point along the way there that Reba might have had a conservative facelift, and at that time also possibly doing some fat grafting or maintaining the fullness in her mid-face, and possibly a little bit of fillers or grafting in her lips just to maintain the little volume she had. Also, I noticed that her heavy upper brow isn't as heavy. And again, over time, heavy brows tend to get heavier. So again, I'm a little suspicious there of some sort of a brow lift, something to rejuvenate the upper eyes and brow in her, as well as open her eyes up, because I do notice that they're a little more open instead of a little bit heavier. And that just doesn't happen on its own. And then I think also if we look at the rest of Reba, she's done something that I always recommend celebrities or people to do, which is she left her trademark nose and hair alone. So again, people aren't distracted by bigger changes or some of the characteristic or keystone features of the face, like the nose. If you change the nose, people usually will notice something. I think it was good that she left those characteristic features because it distracted everybody from the work she may have done. So good for her. I think she looks great for her age, and I just hope she stays on the same track she's on now.
So I've seen some discussion about her smile changing over the course of time. Do you believe that, beyond obviously just teeth, getting braces or veneers or whatever, do you notice anything else has changed with her smile?
Yeah, well, sometimes when patients get facelifts or multiple facelifts, it can slightly change their smile depending on how the vectors were pulled, as well as there's some nerves and things in the face that people have to be very careful of. And sometimes when you see patients after a facelift or multiple facelifts, you can see a slight change in their smile. Sometimes it's asymmetry, sometimes it's just the way that they are smiling. Now, in Reba's case, she also has a very heavy upper lip that's gotten a little heavier, so that may be the issue. But I do notice that she has maintained or has slightly fuller lips, particularly the lower lip. So it is a little suspicious for a facelift.
Is Goldie Hawn an example of someone's smile that's changed from a facelift?
Yes, For sure. You can see when she smiles, sometimes things will pull a little different or be off, as well as if they've been augmenting the lips. So in her case, you can notice that her smile has changed. So then again, I'm very suspicious for multiple facelifts. But I also want to say, if facelifts are done by an experienced surgeon who knows what they're doing and they're conservative, there should be no change to your smile. Again, it should go unnoticed. Good plastic surgery won't change any of your normal anatomy or change your smile. If done with precision, your smile and everything should look exactly the same after a quality facelift.